Welcome back. Well, the Omicron variant of the coronavirus has spread to another region, East Africa. 7 cases now confirmed in Uganda. And in Europe, experts from the World Health Organization say that despite Omicron's rapid spread, the Delta variant is still the top concern. Europe is struggling with a crushing fall wave of the virus. Well, CNN's Salma Abdelaziz is in the UK, which has already seen hundreds of Omicron cases. And Larry Madowo is in Johannesburg, South Africa, where the variant was first sequenced and where cases there are soaring. Good to have you both with us. So I'll start with you first, Salma, because with the Omicron variant spreading in Europe, what is the WHO saying about mandating vaccines?
Well, we heard today from the Europe director, the regional director for Europe of the World Health Organization, and he started by saying we still need to wait on the information about Omicron from scientists. We need to keep cool heads. That was his message to European leaders. But in the meanwhile, we need to have the tools that we've used against the Delta variant, which is right now behind the surge in cases across Europe. Those same tools should work with Omicron. And what are those tools? Well, key among them, of course, is mask mandates. He brought up that only about 48% of masks are worn indoors. 48% of people indoors, rather, are wearing masks across Europe. He wants to see that number rise to over 90%. He says that could save over 160,000 lives in the European region by the spring of next year, just wearing masks indoors. And then, of course, the other crucial tool is vaccines. Now, several countries have been looking at the possibility of vaccine mandates because about 1 in 3 Europeans has yet to be fully immunized. Germany's been considering that. Austria's already put a vaccine mandate in place. This is what the European director of the World Health Organization had to say on those vaccine mandates.
Mandates around vaccination are an absolute last resort and only applicable when all other feasible options to improve vaccination uptake have been exhausted. They have proven effective in some environments to increase vaccine uptake. But the effectiveness of mandates is very context specific. The effect that mandating vaccination could have on public confidence and public trust, as well as vaccination uptake, must be considered.
That means, for now, it seems like the World Health Organization is recommending public messaging. Get the message out there, go into local communities and get people who are yet to be immunized. But it's a big task, of course, Linda. Again, 1 in 3 Europeans still to get the jab. Many of these hardline anti-vaxxers. Meanwhile, as well, the other campaign that's going on across the European region is boosters, boosters, boosters. Here in the UK, the Health Secretary has said that thousands of vaccinators will be hired in the coming weeks. The UK's goal is to get an invitation for your booster jab to every single adult by the end of January. It's a massive feat accomplishment if they can pull that off. But for now, it seems we still have to wait for more information for scientists. So all of this are just preemptive preparations, Linda.
Yeah, a massive undertaking and certainly massive hurdles to encourage those unwilling to get vaccinated to get the jab. Larry, I want to go to you because South Africa's president is not at all happy about the travel bans enacted by many countries on South Africa after South Africa found and identified this latest variant of COVID-19. I understand you were just at Johannesburg Airport. What are officials there saying?
I have spent the whole day at the Johannesburg airport. This is one of the busiest airports in Africa, usually the first or the second. And it is a pale shadow of itself. It's nothing like what I'm used to seeing. I used to live in this city, so I know how busy this is. There are very few international flights that are going out of the country, and a lot of people scrambling to get into them because often they are going to places where there's travel restrictions. Some of them are just repatriation flights. And officials say, for instance, that this is going to be devastating to the tourism economy of this country. This is the top tourist destination in sub-Saharan Africa. And it was only beginning to recover after the shutdowns of the last year and a half of the pandemic. And now the Omicron variant and these very quick travel bans that have been affecting this country. There's a lesson here, according to one expert, who says Africa needs to stop depending on the rest of the world.
If Africa is going to rise, Africa is going to have to look to Africa and Africans. This is a reminder of the selfishness of the West when it comes to issues like vaccine, sharing their vaccines or sharing their knowledge. So it's a reminder that for Africa to thrive again, Africa must look to itself and not and try. We need to get over this need to get validation from the rest of the world.
Selfishness, that is the word Tebe Kalafeng used, and that is something that President Cyril Ramaphosa also used today traveling in Senegal. He says the travel bans against South Africa have been emotional, they have been unscientific, and they have just been born out of selfishness, and he doesn't think that they need to be in place. It's travel apartheid, according to him. But also the message for the local population for South Africa is that you need to get vaccinated, because in the last 2 weeks, the case rate here has increased 1,048%. The positivity rate, Linda, 2 weeks ago was 2.3%. The positivity rate in tests conducted in the last 24 hours up to Monday was 26.4%. So a huge, huge surge in just a fortnight.
Yeah, huge, concerning surge there right across South Africa. Larry Madowo and Salma Abdelaziz, thank you both very much. Well, the U.S. is warning Russia of substantial consequences if it invades Ukraine. Coming up, CNN speaks with Ukraine's defense minister about why he thinks Russia will not invade.